In the UK, a report by members of parliament says failure to do more to stop COVID spreading early in the pandemic was one of the worst ever public health failures. It said the government approach backed by scientists was to try to manage the situation and in effect achieve herd immunity by infection. But this led to a delay in introducing the first lockdown, costing lives. The report by the cross-party group, however, said there had been successes too, in particular the vaccination program. It described the whole approach from the research and development through to the rollout of the jabs as one of the most effective initiatives in UK history. The members of parliament call the pandemic, which has claimed more than 150 lives in the UK and nearly 5 million worldwide so far, the biggest peacetime challenge for its century.
That some of that scientific advice was wrong, but also that politicians should have challenged that advice. And there is never 100% certainty with scientific advice. So you can't just say we're following the science. You have to dig down and ask why scientists are saying what they're saying.
And joining me now is a medical doctor, Femi Oyekon. Good to have you join us, Dr. Oyekon.
Yeah, thank you.
So how accurate is this description of the report that calling how the UK handled the pandemic earlier on as a public health failure?
First, thank you for inviting me once again. I'll say that the facts available and post-mortem analysis of how the pandemic was managed reveals a lot of lacks in regards to how the government approached the lockdown. That's why the parliament, that committee that is investigating this, call it a total failure. Because if you look at when the pandemic, when the UK had the first incident of coronavirus in the country, which was January 31st, and when the first lockdown was instituted, which is March 30th, you see that there is a total of about 2 months. So where we have porous border control, where we had people who are vulnerable and in care home, there were no provisions on how these people could be prevented from having a COVID exposure. So a lot of other factors we looked into to now come up with this conclusion that the management of the pandemic was a big public failure.
And you know, one of the things, or one of the statements in that report, or the findings, was that the UK's government approach was to achieve herd immunity by infection. And to be fair, it wasn't just the UK government who was touting that as some way to achieve herd immunity. Earlier on, just because of the fear that we might not be able to get a vaccine as soon as possible, people thought that, look, or some scientists even said, maybe, just maybe, by infection, we could achieve herd immunity. In hindsight, how do you think that would have played out?
That would be a big catastrophe. Let me manage my words carefully. It would be a big catastrophe to be thinking of the fact that herd immunity was a possible option to manage a disease as deadly as COVID. We would have lost close to about between 500,000 to 1.5 million to be able to achieve that if there were no vaccines, there were no social distancing, there were no face masks. So I think anybody thinking that in that direction possibly will be, it's very suicidal. I don't think any reasonable government will be looking at it, because the options were on the table. But I think it will be very unwise to look at the fact that the possibility of curbing the disease with an effective lockdown as early as possible. There were possibilities of instituting effective social distancing, face mask, and other measures that can effectively reduce the spread of the disease. If you're now talking about using lockdown, using herd immunity, that means allowing as many people to be infected as possible and seeing how many people will possibly die from the disease, and then eventually the people that are alive will be able to have acquired self-immunity through infection by disease. I think that's if it was maybe 300 years ago, that would have been an option. But in this time and age, with advancement in technology and advancement in science, I think that will be an option that would never be accepted on the table.
I want to ask you about what sort of preparations or lessons which can we learn from this pandemic in terms of preparing for health emergencies. But I also just want to ask, do you think that we have learned these lessons and we are beginning to prepare for health emergencies, even just now?
I'll say that in a way, I'll say that it's not just UK that should be conducting a post-mortem into how the pandemic was managed. The good thing is that the pandemic spared Africa to a very large extent. But Africa on its own should be able to conduct its own post-mortem to see what was done right. What can we pick out from what has happened in the last 12 to 24 months when the pandemic initially started, when there was no vaccine, there were no other options to manage it. How best what can we pick going forward? Because the truth is that there is always going to be an outbreak of one or two diseases. But are we going to allow it to claim over 5 million lives before we start thinking about what effective ways we can adopt to curb it? I think that would be a big no. So what I personally think is the fact that it's not just the UK that should be setting up an inquiry body. Regional bodies, countries in Africa, in Asia, and Europe, the whole world needs to come up with a data of what could we have done well in order to reduce, because from the data in UK, it was shown that if the lockdown was instituted a week earlier, they would have saved half of the life that was lost, which is about 70,000 people who still have been alive today. So when you look at the fact that 1 week in instituting the lockdown 1 week earlier would have saved 70,000 lives, that's a lot of lives that possibly would have been saved. So those are the kind of things you possibly will be like, let's look into how this can be done better. Because no doubt, I'm not like trying to say maybe trying to put hope away, but pandemics are always going to crop up. But what we need to get is how best can we manage it from the lessons we have learned from COVID pandemic.
And I agree with you on the Africa part. We need to find out why we didn't have as much cases as were predicted, or if these cases were actually even underreported. Africa needs to do a post-mortem. Thank you so much for talking to us, medical doctor Femi Oyeko.
You're welcome.